We're going to turn now to the protest today happening at Indiana University's main campus. Several hundred people gathered in Bloomington to say that IU should reverse its COVID vaccine mandate.
There were parents there, students there, and others who say they think the shot should be a choice, not a requirement to work there or attend classes. Our Rich Nye takes us to the Rally for Medical Freedom to hear the voices of those who don't want the shot for themselves or their children.
They have many reasons for not getting the shot, clearly stated on signs of protest and by their voices.
To force this on our kids is not just morally and ethically wrong, it's criminal.
Ann Doris is an IU parent and now president of IU Family for Choice, Not Mandates. The group protested at the sample gates during the IU Board of Trustees meeting.
The voice of people to be heard, that this is a very concerning situation for them, that no one should be forced into doing something against their own medical freedom.
These are parents and students and others who are against that mandate from IU that says every student, faculty member, and staff must get the COVID-19 vaccine before next semester.
Laura McCormick just helped her Hamilton Heights high school senior daughter get ready for prom. Laura is reconsidering whether to let her daughter come to IU this fall.
I think that we've let our government and our public-private partnerships go too far with controlling our lives in America.
Jamie Carini is a graduate student who has been advised against the vaccine because of her medical condition, but she's worried she may not get an exemption.
I would encourage students, even if you want to get the vaccine, even if you don't, advocate for your personal choice.
And they believe IU is taking away their choice for a vaccine too new, with too many long-term unknowns.
I don't trust this. I don't trust the pharmaceutical industry. I don't trust the local or state government in Indiana, and I don't trust IU at this point.
IU stands firm for now that starting in August, the shot is required to enter the gates.
Well, Indiana University is requiring the vaccine, but they won't require the documentation that employees and students have actually received the shot. But those who do provide proof will be entered into an incentive program and be eligible for prizes, including full in-state tuition.
IU health workers are also planning a protest. Theirs will take place this weekend. IU Health is the state's largest healthcare system and says all employees have to get vaccinated by September 1st, although you can apply for an exemption for medical or religious reasons. Saturday's protest will take place at 3 p.m. It's going to be on the Canal Walk behind IU Health's Fairbanks Hall downtown near the 10th Street Bridge.
Well, IU Health isn't alone in this. Community Health Network now says it's going to also require its workers to get their COVID shots too.
16,000 people work for the Central Indiana Health System, and about 60% of them are vaccinated. But now Community is requiring everybody be fully vaccinated by September 15th.
And this includes all vendors, contractors, and volunteers who work at community hospitals as well. You can, however, apply for an exemption for medical or religious reasons here too. Well, meanwhile, Marion County is working to get more people vaccinated and reach herd immunity.
The mayor, as we told you, wants to see 50% of eligible residents vaccinated by the 4th of July. So we have about 3 weeks to go, and today we are at 36%. That's why the health department is sponsoring 3 more vaccine clinics coming up this weekend. It's focused on people it considers least likely to get vaccinated and the most at risk of getting sick or dying from COVID.
Well, Community Health Network's also working to get underserved populations vaccinated as well. They recently provided shots for people at Wheeler Mission.
If we don't continue to get people vaccinated because we don't have a treatment, COVID will continue to spread, and we could get variants that then do not respond to the vaccines.
Well, there is also a concern about the number of young people getting vaccinated.
The county wants to see more teenagers and college students come out and get their shots.
Here at Verify, our motto is sources up front. That way you can see exactly where we got all our information. But not everybody does this. Take posts like this one, claiming, quote, CDC quietly releases data showing that 7 out of 10 Americans are declining the experimental gene therapy. It offers no source, but nonetheless, we didn't want to rule it out until we looked into it. So let's verify. did 70% of Americans refuse a COVID vaccine? And here's exactly the steps our Verify researchers took. First, we contacted the agency directly, and a CDC spokesperson told us, quote, "I'm not aware of the origin of this post." Next, we scoured the CDC's website, and there's just no numbers to support this claim. In fact, we found just the opposite. If you look at what percentage of the U.S. population has received at least one dose, it's more than half, 51.6%. And it only gets higher if you look at the percentage currently eligible for the vaccination. 61.1% of those 12 years or older got at least one shot. So we can verify that this post is false. But we kept going to see what official data is out there and found that the federal government is keeping a rough estimate of vaccine hesitancy through a U.S. Census Bureau survey. According to answers collected between May 12th and May 24th from more than 56 million people who had not yet been vaccinated, 11.4% said that they would probably not or definitely not get a COVID shot. 5.7% said they were unsure. So still far less than that 70% in that debunked meme. With your Verify, I'm Evan Kozloff.
There may soon be a second COVID-19 vaccine option for kids. Moderna has now asked the FDA for emergency use authorization of its vaccine for 12 to 17-year-olds. The company says it ran a trial of more than 3,700 people in that age group, and none of the participants who got the shot contracted COVID-19 after their second dose. The FDA already approved the Pfizer vaccine for that same age group last month. Also, we learned today the Johnson & Johnson vaccine can be stored longer than 3 months. The FDA just extended its shelf life to 4.5 months. Now, this is a big deal because a lot of states warned that they had hundreds of thousands of unused J&J vaccines close to expiring. In fact, the CDC says more than 21 million doses of that vaccine have been delivered, but only 11 million administered so far. We've reached out to the state health department here to see what our numbers look like. They told us they're encouraging providers to use short-dated vaccines first to try and minimize waste.